Good evening, all of you. Good evening. We'll wait for everyone to join. Good evening. Good evening, everyone. I'll just type in the chat box. Hi, all. Good evening. Hey, everyone. I can see. Hi, Dr. Verma. Hi, Dr. Thakran. Hi, Sunil. Hi, Dr. Rahman. Good evening, everyone. Hey, Dr. Thakran. How are you? Hello, Dr. Roshni. Hey, Yuvraj. So we'll wait for some of you to join, and then we'll start. Good evening, everyone. So first of all, congratulations, since now you're here in this YouTube channel, which means that you all want to join pediatrics. So a big congratulations to all of you. We'll wait for a few more to join. And then we'll start. So in the meanwhile, all of you can just introduce yourself. You can type in the chat box about your ranks. How was your experience of your journey with dams? You can type in the chat box. How was pediatrics? Just type something in the chat box. In the meanwhile, we'll start. So we'll wait for 2 more minutes and then we'll start. So everyone, you can type in the chat box. Just type. Let's start with the introductions about yourself and how was your journey. I see. I like one comment in the chat box. Someone has summed it all. Dr. Verma is saying in the chat box, pediatrics is the cuter, smarter, and funnier version of medicine. You mean pediatrics or me? So let's go further and let's first talk about uh, pediatrics as a career. And I'd like to introduce myself. All of you, my name is Sidharth Sethi. I did my MD pediatrics from UCMS Delhi. I did my senior residency from All India Institute, my fellowship in pediatric nephrology from All India Institute. From I did my fellowship in pediatric nephrology from US, and then also from other countries from UK. So since last 12 years, I'm a practicing pediatric nephrologist and a kidney transplant physician. So I work in a hospital here in Gurgaon since last 12 years. So I'm one of the antique doctors in this hospital since last 12 years. So before we start and I take your individual questions, I'd like to share with you guys that maybe all of you who are sitting here right now in this YouTube video, in the chat box, first of all, you need to ask yourself, whether you want to be a pediatrician or you're just taking pediatrics for the sake of it. So, the main word I would like to highlight here is passion. So, guys, I never thought about money in my life, and I still don't think about money. It's all about passion. So, if you are really passionate about pediatrics, you really uh, are young at heart. These are some of my patients. She's one of my transplant patient from Russia. uh, you need to be patient. So people who join pediatrics, they have a different aptitude. Okay, so they are not like surgeons, they are not like orthopedicians. Okay, so they are different. So are you someone who can empathize, can communicate well, is patient? Okay, and not like a typical orthopedician. So remember that as a pediatrician, I would like to tell you guys that I usually, children don't talk to me much. Usually we talk to the mothers and the parents. So it is like we are dealing with the whole family. Okay, so don't think that pediatrics is just about seeing a child, treating a child. In fact, you have to deal with the whole family. Okay, so do remember that you have to be a very well communicator, which you will learn with life. Okay, I was also a very impatient kind of doctor initially, but with age, and as with experience now, now we are a better communicator with age. So pros of pediatrics is that we love what we do and we do what we love. So this is in fact the same patient I showed you just now from Russia. She was transplanted around 10 years back and she really loved me. She still does. So pediatrics is a good branch. You smile every day. It's stimulating. You learn every day something new, like in medicine. So it is like a medicine only. You learn every day something new. It's challenging, it's rewarding if you're dealing with babies. Of course, it is satisfying. Now, the pros are that, of course, you will always have a door for private practice. So, in pediatrics, you always have, you can easily do private practice any day of your life. If you feel that you just want to open a clinic, you can open a clinic anywhere, start private practice. Of course, making a practice, whether it's obs, gynae, or medicine, making a practice, having a clientage of a lot of patients, it takes time. Like if you open a shop, your shop doesn't run in a day. So of course, it will take some time before people start to recognize you and start referring patients to you. But yes, there is a lot of scope of private practice, there's no doubt about it. In private practice now, of course there is a scope to develop a lot of special interests, like uh, I am doing right now. I have a special interest in kidney transplantation, special interest in dialysis in children. So this is what I do, and if you just maybe Google about me on the internet, you will find that since I'm passionate about this thing, I do, I do a lot of academics, research, lot of things in the same area because I do and I like what I do. Now, the cons, I just read someone in the chat box about work life balance. Guys, uh, what is work life balance? What is the definition of work life balance? I think it all depends on what you are doing in your life. To me, pediatrics is my life. So, even in the middle of the night, even tonight at 2 a.m., if I get a call from the hospital, I don't mind going to the hospital. And I don't think that means I have a bad work life balance. It all depends on your state of mind. So, by work life balance, I don't think, guys, at your level, you should start thinking about work life balance. Your next few years is to learn. So, I think devote your life and the next few years in learning. Okay, don't start thinking about family balance and work life balance. Try to find happiness in what you're doing. If you're not happy after joining your MD seat, then you are in a wrong seat. Join only a seat which makes you feel happy. Okay, don't think my parents told me to join pediatrics, my boyfriend told me to join pediatrics. It's not about that. Join what makes you feel happy. Even in the middle of the night, every day going to the clinic, it should make you feel happy. Okay, so join that. Of course, yes, you will have night duties for at least for the next I would say next 6 years, you should be doing night duties. Okay, so I have done night duties for almost 9 years of my life. But yes, that is how you learn in your life. When you're right in the middle of the night, you're alone in the emergency, that is a time when you really apply your mind and you learn. So yeah, but part-time working can be problematic in pediatrics. So you cannot be, doing part-time jobs in a lot of hospitals, because we do have sick patients. So we do think about joining maybe one hospital and the other hospital. Now there's a question in the chat box. Someone is asking me, sir, should I join pediatrics or medicine? If you're not thought about, if you think, if you're equating pediatrics with medicine, you're wrong. Okay, so if you're confused about medicine versus pediatrics, I would suggest take medicine. Okay, I cannot imagine myself, seeing geriatric patients. So maybe after medicine, yes, maybe you have a lot of patients. Suppose you join endocrine after medicine, of course you'll get a lot of patients. So pediatrics is a different specialty altogether. You cannot equate pediatrics with medicine. Okay, so if you have still not decided, Dr. Komal, what to take in your life, then maybe medicine is the way to go. Okay, those who join pediatrics are really the ones who really are passionate about pediatrics. They are not confused like you. Okay, so don't mind, Dr. Komal, but I think if you are confused, maybe medicine will give you more patients. You'll have a lot of geriatric patients, and you can see those patients and find happiness in your life. So of course pediatrics is mostly a high intensity branch. So even in the middle of the night you will get calls for newborn babies. You can run a short clinic. Like if you want to run a small clinic, you can run a clinic and earn lots of money with just vaccination also. But still, it is possible that most of the time you will have to attend some newborn deliveries throughout your life in between. Okay, so now that we have talked about some pros and cons, uh, let me talk about the issues which you are asking me. And I can see a lot of students in the chat box talking about uh, Dr. Sandhu talking about DCH, Dr. Vridhi talking about DCH. See, listen to me carefully. If you can get MD pediatrics in any government hospital of India, MD is always better. Okay, any periphery, MD is still better, because MD is, the name is, it looks better. Though MD is equal to DNB, don't ever think that MD is not equal to DNB. MD and DNB are now completely same. Okay, so but still, if you can get MD, try to join MD. Number two, it is easy to pass MD. Your examiners, your guide is most of the time, he knows your examiners. It is very easy to pass MD pediatrics as compared to DNB. DNB is a very good course. It's a very well structured course, and so you have a very well structured exam also in DNB. So DNB is now a very good branch, and it is a very good stream. But yes, you need to be thorough in pediatrics to really pass DNB, because your examiners will be completely different. Your examiner may be, someone who is in some other state, and you may have exam somewhere else. So if you do not get MD, yes, DNB is a good option, Dr. Pandey and Dr. Jain. DNB is a good option. Okay. Of course, if you are staying in Delhi, yes, Gangaram is a good option for DNB pediatrics. St. Stephen's is a very good option. There's no doubt about it. Okay. Now, lastly, if you are really passionate about pediatrics, you always thought about, someone like me who always thought about doing pediatrics in life and never ever thought about anything else. And this shot of your NEET PG was your best shot. So this was your best shot, and you are sure that maybe the next shot may not be the same. So you can take DCH. You can take DCH if you are really passionate about it. If you are someone like Dr. Komal who was not sure about medicine versus pediatrics, then don't take DCH. If you're not really sure about pediatrics, then why to take DCH? Maybe join MD in some other branch. Uh, like maybe MD anesthesia is a very good branch, MD pharmacology is a very good branch. So DCH is only for the die-hard ones, who really wanted to be a pediatrician. There's a question in the chat box about DNB passing percentage. So yeah, passing percentage is nowadays improving in DNB. It is much better nowadays. But still, if it is 50 to 60% here, in MD it is almost more than 90% chance that you will be passing. So try to join MD if possible in a peripheral, even in a periphery government hospital. That will be completely fine. See, listen to me carefully. Learning is a lifelong process. Don't ever think that you will become a pediatrician in these 3 years. No way. These 3 years are just for passing your exam. Okay, you will learn a lot of things like critical care, dialysis, bronchoscopies. It is a lifelong process. Okay, so these 3 years are just for passing your exam, guys. I don't know who taught you that these 3 years you need to be learning everything, intubation, everything. You have a life to learn. Get a get a degree, okay, and then of course you can join senior residency in some government hospital in a big tertiary center and learn a lot of things. Okay, now there are a lot of in the chat box there are a lot of students asking some personal, like specific questions like what should be the preference in Delhi, what should be the preference in Rajasthan. So maybe what I'll do is I will also tell you about my email address, and on Insta. I know most of you have moved on to Instagram and are not on Facebook anymore. So I'm on Instagram on Sidharth Sethi. So I do some some quiz for PG aspirants on the Instagram. So maybe you can ask me there. And I would like all of you to know that Dr. Sachin Arora from Psychiatry has made a very good list of medical colleges from all over the country. And you can follow the same for pediatrics also. So whether you are from Gujarat or Rajasthan or Madhya Pradesh, Maharashtra, you can follow the same list which Dr. Sachin Arora has made. Okay. Okay. So we talked about this. Let's talk about DCH. We have already talked about DCH. That if you are really a die-hard kind of person only for pediatrics, never thought about doing anything else in your life, I would say all MDs are good. There is a scope of MD anesthesia. There is a scope of MD pathology. There's a huge scope even for pharmacology. So guys, if you can get a MD, your life becomes easier. Someone was talking about sir work life balance. So MD will give you a good work life balance. DNB and DCH will still should be after an MD in a government hospital. Okay. Now senior residency. The issue is pediatrics a 3 year affair? And the answer is, if you are in a small city, a second tier or third tier city, and you want to open your own hospital, your own clinic, then 3 years of MD pediatrics is fine. But if you are working in a metro, if you're working in say Delhi, Hyderabad, Bangalore, Pune, Mumbai, then you need to learn more. So personally speaking, I would suggest either do a super specialization or a senior residency, because I told you, you don't learn everything in those 3 years of your PG. So you need to do something more after your PG. Maybe spend that time in getting a super specialization or senior residency. See, all the pediatricians are practicing neonatologists. So in our country, we are more than 30,000 pediatricians. Okay, so we are all members of Indian Academy of Pediatrics. I'm also a fellow of Indian Academy of Pediatrics. So everyone is practicing neonatology. So maybe you need to learn more after your PG. So you should join either a super specialization or a senior residency. Okay. Now someone is saying, sir, is there a age bar in DNB? So basically, it's not like that. It's about think and ask yourself, if this was your best shot, then of course go for MD or DNB or DCH in this order. MD from a government hospital, DNB in a good institute is good, okay, followed by a DCH. Okay, I like this picture of mine. This is one of my patient from Kenya, and this is almost a 10-year-old picture. So she is now a beautiful, tall girl, and I'll show you a picture when she comes back to me to visit me in India. So she has changed. So have I. So let's talk about super specializations. Now, there's a student in the chat box, Dr. Rajan, saying, do we really need to do super specializations? And the answer is actually, it depends on your own passion. If you're working in a metro, yes, super specialization will give you an edge over the others. Okay, if you're working in a metro. Otherwise, 99.9% of pediatricians in our country are only MD pediatrics or DCH pediatrics, and they are practicing neonatology. They're not even DM neonatology. So, if you have to, it depends on what you plan to do later in your life, where you want to settle down. Okay, if you want to settle down in a, say, in a small city, you don't need to do super specialization. In fact, you will be restricting yourself by doing a super specialization. Okay, but in big metros, yes, super specialization does give you an edge over the others. Okay, so diploma DCS, Dr. Khan, I've already discussed that it depends. If you were really passionate about pediatrics, you cannot get anything else, this was your best shot, then of course you can go for DCH. But still, after DCH also, there is a scope that you can do a secondary DNB later on. So after DCH, you can go for a secondary DNB later on, which will be of 2 years. Scope of neonatology, of course, like I said, all the pediatricians are practicing neonatologists in our country. 99% of the neonatologists in our country are not DM neonatology. Okay, they are mostly MD pediatrics and they are running their own centers. So there is a huge scope of neonatology, there is no doubt about it. Okay, vaccination, seeing normal babies will give you a lot of money. If it was all about money to you, neonatology, vaccination will give you a lot of money. Okay, so there is a scope of neonatology, and of course, there are a lot of neonatology fellowships also. It is not just DM. In our country, we have a lot of fellowships in neonatology, a lot of fellowships in pediatric endocrine, and a lot of more branches like intensive care. There are a lot of Indian Academy of Pediatrics fellowships of pediatric intensive care. There's a pediatric intensive care fellowship by the Indian Society of Critical Care Medicine. There are a lot of fellowships also available. So DM, now NEET SS is a very good exam. So all of you should be, if possible, give a NEET SS. Okay, and at DAMS, we are like, like LIC, we are PG से पहले भी, PG के बाद भी. So we are with you, So now I run a course for even NEET SS also. So on the eMedicos app. So there's a course by me for master classes for pediatrics. On eMedicos app, there's a course for NEET SS. So I would suggest at least give a NEET SS exam after your MD. Okay, this will give you, lot of options. So NEET SS is good. Fellowships are available in many branches, like I just told you, whether it's endocrine, intensive care, neonatology. A lot of fellowships are available still, Especially, I will again repeat, neonatology fellowships, pediatric intensive care fellowships, pediatric endocrine, a few of pediatric nephrology, and so on. DM seats have increased. I recently got a call from PGI that PGI has now 11 DMs in pediatrics. So 11 subspecialty DMs have opened up in PGI, including pediatric rheumatology, pediatric pulmonology, pediatric intensive care, pediatric nephrology. So there are some centers who have started DMs also in pediatrics. Okay. So first of all, become an MD. Why are you rushing for fellowships? Dr. Jan, I would like to talk to you. Once you have done your MD, then talk to me about fellowships. Now, I can see some of the students have a confusion. Sir, should I join MD pediatrics or medicine? Beta, if after your MD, ideally you have to join. If you are joining DM, you have to join a DM in pediatric super specialty only. Don't think I will do pediatrics and then I will go for adult DM cardiology. Those days have gone. Now the new NEET SS pattern will have questions on MD medicine also and cardiology. So please, if you're planning to join an adult DM after your pediatrics, please do not join MD pediatrics. Okay? If you want to join an adult cardiology later on, adult nephrology later on, please do not waste a branch of some other student who could join, MD pediatrics. Okay, you getting my point? Because if you join an adult DM after your MD pediatrics, your pediatricians will not acknowledge you because you are an adult DM. Your adult DM colleagues will not acknowledge you because you are an MD pediatrics. So they will say that you should be a pediatric cardiologist. So they'll only give you patients of pediatric cardiology. So try to, join a DM of pediatric super specialty. Don't waste a branch of a pediatrician. Okay. Thank you, Dr. Manjal. Dr. Jan is asking about fellowships. Dr. Jan, see me once you join a MD or DNB. See me after that. Now, what about MRCPCH? I get a lot of emails from you guys. Sir, you have not even joined MD and you are thinking about going for MRCPCH. Guys, I'm MRCPCH. I'm even a FRCPCH. I recently got fellowship from the Royal College of Pediatrics and Child Health UK. And this September, I'll be going to London to collect my fellowship. But it is of no use. Okay, this is just, I've just collected some degrees, but I can tell you this is only of use. Number one, if you want to join Middle East. In Middle East, you may get a lot, you may get more money if you are MRCPCH. If you want to join Saudi Arabia, Dubai, Oman, then MRCPCH is good. In our country, MRCPCH is just an added thing. No one recognizes that. Okay, you will not get money in India after going through 3 lakh rupees. So you'll easily spend 3 lakh rupees to get this tag to you. Okay, so don't, right now is not a time to talk about MRCPCH or FRCPCH. We'll talk about this later. Okay, it does not give you anything. Okay. Now someone is asking about some medico legal cases. But now medico legal cases are in every specialty. Okay. So of course, your note should be complete. You should have a legal insurance and indemnity insurance with you. Everyone has an indemnity insurance these days. Your note should be complete. Of course, you have to talk to the families. That is true for every branch. You tell me a branch which does not have a medico legal implications. Okay, so it is everywhere. It's not just about pediatrics, it's everywhere, whether it's orthopedics, vascular surgery, transplantation, everywhere. Pediatrics is good because you don't need a lot of money for setup. You can easily set up a clinic. You can tag yourself with some obstetrician, and collect the babies, and you can get a lot of money by that. Okay, so cost of setup is not too much in pediatrics. If you want to even run a short NICU, you all you need is just few NICU machines, CPAP machines. So we just have half of neonatology is all about CPAP. So you just need few CPAP machines and you can run a NICU also. So that's a pro part of pediatrics. Government jobs, all of you, please talk to Modi ji. We don't have a lot of government jobs yet in our country. So, but it doesn't mean that you will not do good. I can tell you guys. Maybe 12 years back, I wanted to join a government job, but then I did not join a government job, and I can tell you in front of all of you right now that I have done much better than my colleagues who joined a government job. Okay, and I could prove myself. So, guys, there are less government jobs for sure in all specialties. So you are not joining MD or DNB today to become a doctor in a government setup. Those teaching jobs are very less in our country. We don't have a lot of jobs. So it depends on you. If you really stick around in a government institute, you will get this. Okay. We don't have DNB pediatrics in Medanta yet. It is coming very soon though in the next few years. So now is the time to take some personal questions. But before I go to the personal questions, guys, I'm happy to share with you that since last 2 years, I'm running a course on e-medicos. It's called Master Classes. So today, maybe you can just go on e-medicos app and just look at the master classes. So what I do is that since last 2 years, almost every week, I have done a class. So we have almost 150 lectures available on the eMedicos app, and these are lectures, cases, presentations, guidelines which you need to know. So, and even I have lectures on how to work in the first year PG, how to discuss and which which topic you should take for your thesis. So there are many interesting things which will help you in your PG life. When you are right there in the middle of the night in the emergency, you can just put your AirPods on and listen to one of my lecture. Yeah. It will make you a better PG, I can tell you. Now, I have a student asking about why is DNB peds having low passing rate? Because pediatricians, they are good clinicians, so they expect a lot clinical stuff from you guys. So if you're joining DNB pediatrics, of course you'll have to work more, you'll have to read more. Definitely join the eMedicos course of master classes. Medicine versus peds, again the same question. If you're really confused about medicine versus peds, maybe take medicine. Okay, pediatricians is all about people who really want to work with babies. I know you may ask me, sir, how do I know that I can be a good pediatrician? Maybe spend some time in a government setup over the next few days. You still have time for your counseling. Just spend some time, and if you can get an idea, don't come to my clinic. My clinic is a very different clinic, and my of course you are welcome to see me in my clinic, but my clinic is a different clinic, and since I have made it over the last 1 decade, so you will not be actually doing that stuff because it takes time to build up those things. But maybe go to a smaller setup, go to a government hospital, see how pediatricians work there. Now, this is a very good question. Someone is asking, DNB in a good institute or MD in a private college? See, if you can get a DNB in a good institute, of course, it is a good deal. There's no doubt about it. Of course, if you are getting DNB in a good institute, look at whether they have really academics there or not. If you have academics in that DNB hospital, whether it's in Delhi or Mumbai or Pune, you can join that. Now, I cannot tell you about joining a private college. It depends on your circumstances. Okay. So DNB in a government college is of course a very good deal. Okay. So please look at the academics in your hospitals. If academics are still, if they are good, like you are in say St. Stephen's, then you can join that hospital. Okay. Now for list of institutions, please talk to Dr. Sachin Arora, psychiatry. He'll give you a very good list, which he has made over the years of all the states, and you can follow the same list for pediatrics also. There's not much difference between uh, different specialties in that list. Now, over and over, people are asking about work life balance. Beta, it is the time to learn over the next few years. So, why don't you enjoy this phase of life? Why are you scared about work life balance? If you're so scared about work life balance, maybe join a startup somewhere else. Don't be a doctor. Okay. If you are a doctor, enjoy this phase of life. Enjoy learning every day, learning new things, read about patients. I can tell you over the last many years, whatever I have accomplished in my life, I have accomplished all because there were a lot of patients for whom I wanted to do something extra for those patients. I wanted to do maybe get them a new drug, maybe get them a new treatment, and we were able to do it in the last many years. And that is how I define success. So it is not about work-life balance. It's about making you feel happy from inside. Okay. So DNB peds, if you are really die hard for DNB for pediatrics and you don't have an option of MD even in a peripheral setup, then you should join DNB pediatrics. Okay. So first, of course, you have to go for MD. Okay, because MD still has a good tag, easier to pass as compared to DNB. Even in a peripheral setup, if you can get it even in the most periphery part of the country in a government setup, you should take MD. Any other questions, everyone? In the meanwhile, I'll just type my email address and my Instagram because I have recently realized you guys are not on Facebook anymore. So I had to hunt you down on Instagram. So here is my Instagram ID. Now here's a question, sir. I want to do neonatology later on. Of course, even after DCH, you can join neonatology. There are, I can tell you, there are almost hundreds of fellowships even available for neonatology. There's a NNF fellowship by the National Neonatology Forum. So maybe contact me after you join your DCH or MD. I can tell you a list of a lot of institutes which are offering fellowships, and most of them are from the NNF fellowships. DM is not essential, Dr. Joseph. If you're working in a big metro city nowadays, some DM students have slowly started coming up. It's just the beginning of having some DMs consultants in our institutes. So DM is not essential. You can be a practicing neonatologist with MD pediatrics. Dr. Bipradeep is asking me, sir, what are the options for DM? Uh, why don't you join MD first and then we'll tell you the options for DM? Uh, PGI has 11 pediatric super specialty DMs, and there are many DMs which are not many students are still appearing for it. So there are a lot of options in PGI, a lot of options at All India Institute, St. John's Medical College, a lot of DMs coming up. Of course, yes, Dr. Rahman, you can join fellowships after DCH. NEET SS all of you should give. There's no doubt about it. You should all try your luck at the NEET SS, because this is a very good way to join DM oblique FNBs also. Nowadays we have FNBs in super specialties, fellowships by the national board. So there are a lot of fellowships. So they are all through the NEET SS exam. Any other questions? Anyone? So if you really wanted to be a pediatrician, guys, simple. I have only one sentence for you. If you really wanted to be a pediatrician, join it. Now there's a student who is saying, "Sir, I don't like collecting blood, etc. Will I develop a liking after I join?" Dr. Rajan is asking this. It's like, arranged marriage. Someone is asking me in the chat box, "Sir, will I develop a love after arranged marriage?" Um, I have no idea about that. Okay, so I believe in love marriage. So guys, you know, I believe you should be in love with your branch and then join, a branch, rather than falling in love later on. Now someone is asking a DM gastroenterology. Uh, Sanjay Gandhi PGI has a lot of DMs in pediatric hepatology, pediatric gastroenterology. Sanjay Gandhi PGI has PDCC, postdoctoral certificate course in pediatric gastro, pediatric hepatology, and even in endocrinology. So Sanjay Gandhi PGI has a lot of these branches available. Even in Delhi, in ILBS, Institute of Liver and Biliary Sciences, they also have DMs available for pediatric hepatology, pediatric gastroenterology. Pediatric hepatology is coming up very fast now. A lot of my friends are involved in pediatric liver transplant in multiple institutes of Delhi, Gurgaon, Chennai. So a lot of institutes are coming up with pediatric liver transplants. But guys, why don't you join pediatrics first? So I would like to, on behalf of the DAMS family, congratulate you that now you are here talking about pediatrics. And I would also like to welcome you all to the gang of pediatricians. You like to do pediatrics, and here you are. Please join pediatrics, and I'll see you there surely. And of course, join this e-medicos course, and we will be there, mentoring you always. So if you are still thinking of, so ask yourself, guys, if this was your first shot or not. So Dr. Vinay, if this was your first shot and this was not your best shot, you can try again. But if this was your best shot, then join what takes you through the way of pediatrics. Okay, guys. Now, I, on Instagram, I'm seeing everyone has the same story. Toxic hai yaar, toxic. Guys, toxicity is you know, it's a state of mind. Why don't you enjoy? Yes, in the first 2 years of your MD, you have to try to stay in the hospital. Why are you even thinking about going for a movie, guys? Stay in the hospital, enjoy that life, make friends with your colleagues, make friends with your nurses, chechis and chetas, be friends with them. Enjoy this. You'll remember this throughout your life. Okay? So toxic is again a state of mind, okay? So if you're staying there, you are one of the hard worker guys. You work there, you literally stay there. Enjoy that. If you can't enjoy that, don't join pediatrics. Okay? You may feel I was a bit rude, but yes, if you can't enjoy this, then maybe join something else, which gives you more happiness. Ultimately in life, the only thing which matters is happiness. It doesn't matter what your parents said, what your boyfriend said, what your fiancé told you. All that matters is, what makes you happy every day whenever you go to the hospital. Okay. Now, someone wants to treat adults after MD pediatrics. Please don't do that. Okay. Don't waste a pediatric seat. If you want to see adults after this, join MD medicine right now. Okay. Don't waste a branch of us pediatrics guys. Okay. So enjoy. Okay. Enjoy this state of life. Okay. We all became doctors because we like to be doctors. Okay. Did we become doctors just to earn money? If you had to earn money, you had you could have opened a restaurant, you could have opened a bar, you could have earned more money than being a doctor today. So you became a doctor for the passion of medicine. Okay, so enjoy this state of life and enjoy pediatrics, and this will give you a lot of happiness and satisfaction. Okay. Yes, being in a pediatrics ward is happiness. Yes. Okay. So that was all for the day, guys. Please feel free to mail me or tag me on Insta, and we'll continue this conversation. Okay. And if you join pediatrics, uh, join our pediatrics masterclasses, and a lot of things, lot of videos. This conversation will go on. Okay, it is not stopping here. We'll keep on talking about this also later on also. Okay. I hope this session was useful to all of you. And on behalf of the Dams family, I wish you all the best in life. And I'll see you, of course, on the other side. Uh, I do a lot of meetings, a lot of academics, research in pediatrics. So I will surely see you on the other side. I do a lot of workshops. In fact, next week I'm doing a workshop for PGs of Haryana on dialysis and acute kidney injury. So next week I'm doing a workshop in Haryana on 18th of this month. So of course I'll see you. Okay, thank you. Good night and all the best. Good night.